Dorothy Orem was born July 15, 1914 in Baltimore, medical doctor. Her father was a construction worker and her mother was a homemaker. She was the youngest of two daughters. Orem died on June 22, 2007 in Savannah, Georgia, where she had spent the last 25 years of her life as a consultant and author. She was 92 years old. Education. Orem attended at Seton High School in Baltimore and graduated in 1931. She received diploma from the Providence Hospital School of Nursing in Washington, D.C. in 1934 and went to the Catholic University of America to earn a BSN Ed in 1939 and a MSN Ed in 1945.
Her early years in nursing included OR nurse, private duty nursing, pediatric and adult med-surg staff nurse, ER evening supervisor, biological science teacher, and director of the Providence Hospital School of Nursing in Detroit, MI. Publications and works. In 1959, Orem helped publish the guidelines for developing curricula for the education of practical nurses. In 1971, first published her formal articulation of ideas in nursing, concepts of practice. Subsequent work of her theory were published in 1980, 1985, 1991, 1995, and 2001. Orem's believes that people should be self-reliant and responsible for their own care. People are distinct individuals. Nursing is a form of action, and a person's knowledge of potential health problems is necessary for promoting self-care behaviors.
Orem's self-care model is a significant contribution to nursing education and the profession of nursing. It also promotes recovery and healing. According to Dorothea Orem, nursing is perhaps best described as the giving of direct assistance to a person as required because of the person's specific abilities in self-care resulting of personal health. Orem's self-care model consists of three interrelated models. First, the theory of self-care. Second, the theory of self-care deficit. And the third is the theory of nursing system. The first component of Orem's self-care model is the theory of self-care. In self-care, evaluation begins with a nursing assessment to identify activities that the patient initiates and performs independently to maintain life, health, and well-being. In self-care agency, the nurses assess the patient to engage in self-care taking age, gender, and environmental factors. In self-care requisites, it composed of three factors: the universal, the developmental, and the health deviation. In therapeutic self-care demand, this evaluates total care activities needed to meet the individual self needs at the moment or even over the moment of time. The second component of Orem's self-care model is the theory of self-care deficit. In identifying needs during this phase, the nurse confirms the needs and imitation of the patients. Once the needs and imitations are confirmed, the nurse begins to implement Orem's 5 methods of helping. The 5 methods of helping is first, acting and doing for others. Second, guiding. The third is physical and psychological support. The fourth is promotion of personal development to meet future demands. And the last is teaching. The third component of Orem's self-care is the theory of nursing system. Role of the nurse. Outline how the patient's self-care needs will be met by the nurse, the patient, or both. Nursing system classification. First, fully compensatory system consists of complete care to the patient by the nurse because the patient is not able to perform any of their self-care activities. educative. The person can perform or can and should learn to perform required measures or externally or internally oriented therapeutic self-care but cannot do so without assistance.
Self-care theory meta paradigm. Nurses should only do for the patients what they can do for themselves. Patients actually want to care for themselves. Ang self-care theories daw may apat na concept to a person, environment, health, and nursing. First is person. The recipient of nursing care being who functions biologically, symbolically, and socially has the potential for learning and developmental subject for the process of nature has the capacity for self-knowledge and engage in deliberate actions, interpret experiences, and perform beneficial actions can learn to meet self-care needs. Man's capacity to reflect on his or her own experience in the environment and her use of symbol, ideas, words that distinguish him or her from other species, who is in need of assistance in meeting specific healthcare demands because of lack of knowledge, skills, motivation, or orientation. Environment encompasses the elements external to man, but she considers man and environment as an integrated system related to self-care. Environmental conditions conducive to development include opportunities to be helped, being with other persons or group where care is offered, opportunities for solitude and companionship, provision of health for personal and group concern without limiting individual decisions and personal pursuits, share respects, belief, and trust, recognition, and fostering of developmental potential, health, state of wholeness or integrity of the individual human beings, his parts and his modes of functioning, responsibility of total society and its members. A healthy person is likely to have sufficient self-care abilities to meet his or her universal self-care needs. Not only bodily state but also how to one function in everyday living and progressive development that is moving toward higher and higher level of integration and functioning. Lastly is nursing. Actions deliberately selected and performed by nurses to help individuals or groups under their care to maintain or change conditions in themselves or their environments. Goal of nursing to render the patients or members of his family capable of meeting the patient's self-care needs, to regain normal or near normal state of health in the event of disease or injury, and to stabilize, control, or minimize the effects of chronic poor health or disability. It is the ability to assist others in design, provision, and management of self-care to improve or maintain human functions at some level of effectiveness.
Case scenario: Kuya Eddie, a 45-year-old jeepney driver, suffered a vehicular accident along the highway of EDSA after an almost direct collision with a delivery truck. He was found still alive by the paramedics. He was rushed to the hospital and was given treatment of severe blood loss. After a physician and nurses examined the patient, they found out that the lower left leg was torn off. It had been completely fractured in the leg, and that it had severe injury to the right inner thigh and foot, massive muscle damage, and head injuries. After an emergency surgery, the patient is now in a coma due to blood clot on the brain. He then got another surgery to remove the blood clot, but Eddie, however, did not wake up after that. The physicians are starting to give up, knowing that not many have recovered a comatose state. After a month, he woke up, and his body became like a vegetable. The physician said that Eddie would be paralyzed for life. However, Eddie, being a person of faith, believed that he can overcome this trial. Every day, he willed himself to walk and held a mental picture of him walking as the nurse did range of motion exercise. After a few months of therapy, the attending physicians were stunned. One morning, Eddie suddenly sat on his bedside. It was a miracle. He could move his legs. After a few weeks, he now can stand and walk with a limp. The physician ordered that the client be given and taught how to use the crutch as an assistive device. Lisa, an orthopedic nurse, was tasked to perform health teaching and guidance to Kuya Eddie.
Assessment. Keeping Orem's self-care theory in mind. The nurse will identify probable needs and evaluate clients' potential for independence. Nursing care would start the mind's only compensatory state, which is from comatose paralysis, and next partial compensatory state, where the client will be taught the use of assistive device to aid in mobility, adverse perception of disability, and possible lifestyle adjustment and consideration.
Diagnosis is self-care deficit related to total paralysis. The knowledge deficit related to use of crutches, and the planning is the nurse would collaborate with the client in setting attainable goals with emphasis on client empowerment and attaining independence as quickly as possible.
Implementation. Number 1. Assist clients' perceptions and disability, lifestyle changes, and coping mechanisms. Number 2. Demonstrate use of scratch walking and pacing using visual aids, proper therapeutic communications, and demonstration. Number 3. Involve support, family, loved ones on the discussions and address their questions and concerns. Number 4. Refer the client to a physical therapist for collaborations and further guidance. Number 5. Ask the client to demonstrate knowledge and competency to evaluate self-care capacity. Evaluation. The nurse, together with the client, after a few days of instructions and counseling, would agree on whether the goal is met or not. Eddie would then be encouraged to set new goals for himself.
Acceptance by the nursing community. For practice, Orem's self-care deficit theory has been used in studies in clients having heart problems, cancer, and mental illness. Orem's theory had been widely used in dealing with geriatric cases, especially those having chronic illnesses. The use of her theory gave way for further studies in health promotion, self-care, and family caregiver stress. In the communities, several government health agencies used her theory to practice as well. In areas of nursing such as occupational health, Orem's concepts are used to define nursing activities that deals with job-related hazards. The ability to identify health problems, interpret data, and come up with conclusions is very important in occupational health nursing. Orem's theory was being used in defining the roles of the nurse in multiple settings. There are also several reports that the self-care deficit theory is used in the development of clinical measurement approaches. For education, the use of Orem's theory in curriculum development was reported in the late 1970s. The theory is used at all levels of curriculum and in continuing education. Some American universities continuously use her theory as a strong and effective framework for curricular design. Gradually, focus on preventive health care is being introduced also in nursing schools. In research, a number of researches derived from Orem's theory can be classified relating to the development of research instruments for scientific measurements of the components of her theory and studies that test these components. One of the first instruments developed is the Exercise of Self-Care Agency or ESCA, which was published in 1979. Another instrument developed is the Appraisal Self-Care Agency or ASA. This scale was developed to measure the core concept of Orem's self-care deficit theory. Both of these instrument tools are used to assess basic conditioning factors and self-care abilities related to the care of well and the ill.
Created using Powtoon.